Good evening, ITV Gold viewers. I'm Nidhi Kathuria and I'll be talking to my guests who are representing AristaCare Indian Nursing Home that provides post-acute inpatient rehabilitation, memory care and long-term care services. Welcoming Mr. Mukund Thaker, President at Indian Nursing Home Program, Joselyn Delgado, Director of Business Development, and Robert Greenberger, Executive Director of AristaCare Health Services. We are also joined by Padma Shri recipient Dr. Sudhir Parekh, Chairman of Parekh Worldwide Media and ITV Gold, who has come to show his support to AristaCare. Welcome all of you.
Thank you.
Thank you.
Starting with you, Joselyn, you started your career as a certified therapeutic recreation specialist working with the senior population. So tell us about the experiences and the challenges, and tell me about the learning curve which led to the program called Nostalgia Park Development. It sounds very fancy, like a show on Netflix. I was very curious about this.
Yes. So as a recreation therapist, I was able to work directly with the patient. So I was able to get a good feel for memory care and dementia care and their needs, working directly with them. So I worked with Robert and a few other people in the building to kind of cultivate a nursing home dementia program called Nostalgia Park, which was Robert's baby that he brought into our building, and we kind of ran with it. We focused primarily on them, the patient. We catered to what they needed day to day, a routine, the feeling of belonging, normalcy, the feeling of losing the word.
So Robert, this would be the individualized care or patient-centric care we are talking about?
Exactly, yes.
Thank you.
Okay. There you go. Exactly. I've done my homework.
Yes. It's patient-centric care, which is really key. You know, sometimes an organization comes in and they create their own vision of what they think care should be, and they superimpose that on whatever's going on in the facility. We believe for every individual, you need to build your own facility as much as humanly possible. What I mean is, we want to, before I come in and say, this is a great idea, this is what you should be doing. The first thing you need to do is zip your mouth and listen. So what Joselyn helped terrifically is we came to this building, we had this Nostalgia Park idea in all our buildings. And I would come every week, 2 weeks, 3 weeks to the building where Joselyn worked. We'd have a meeting and I would say, okay, you tell me, based on your building and your patients that you're dealing with, what are the needs that you have to build your program? So what Joselyn did for us was like, okay, Robert, this great idea that you have, because I come up with some like these crazy ideas. She says, Robert, calm down, that doesn't work here, but let me tell you how to make it practical. So the fact that she worked directly with the patients to be able to know really what the patients need was a terrific help for me to say, okay, this Nostalgia Park baby of yours, here's how you bring him up and get him off to school. Now, this is what you need to do practically to make it work. So that was Jocelyn's real help.
In our building. It works differently in every building.
Yes.
So, Mr. Thaker, being the president of the Indian Nursing Home Program, tell us what all does it entail?
I started my career in '89 to 2005. I was working in a nursing home, and in my experience, I find out that the older people need comfort, culture, and care. The people come to the nursing home for better life, but because of the language, because of the food, because of the environment, because of the language, they are not really comfort over there, and they come for the really better life, but because of all these things, they are not really happy over there. So it was in my mind, let's do something for the community really need. And I hold the program, Indian Nursing Home Program, and I create the whole Indian environment I put all the decor and temples and Indian nurse, Indian doctor, Indian food. And we started this program in 2005, and the community liked this program so much. And within less than a year, we have almost like a 52 residents. And then later on, I have continuously people calling me for the Indian program. I have a patient from 65 to 105-year-old people.
Wow.
We give them everything, whatever we can at home, whatever they do. We have a temple in a premises. We do the aartis and pujas, and we celebrate all Indian festival, and they like it. Nobody want to go home from once they come to the nursing home. So this program is a very successful program, and all the residents came from, not only from New Jersey, from LA, Texas, Chicago, Florida, from everywhere. They're calling me to come to the nursing home.
What is the ratio of the Indian people out there compared to your regular patients, other ethnicities?
We have in our South Plainfield nursing home, in AristaCare, Cedar Oak Care Center, we have a total American and Indian altogether 200 and almost 50. Out of 250, I have 112, 113 residents right now.
Dr. Parikh, tell us about your association with AristaCare.
Well, I think my association is starting from the inception of the Indian section of the nursing home in 2005. That time I happened to be president of the Federation of Indian Association, which is the largest umbrella organization. And Mukund he came and met me and then explained to me, and during our program, annual gala program, we promoted this nursing home concept, and it was a great concept, because even though you have everything at home, but sometimes what happens is the social life, means social interaction at that a certain age is very important for the health of the mental health, physical health, and all health. So this is a nursing home. Why it becomes so popular? Because there is a lot of good social activities, plus the food, as Mukund says.
Yes.
Because see, we are coming from the certain ethnicity, and our food is little different than regular American staple food. So, and at that age, you cannot change yourself. If you are young, then of course you can adapt the new food, new cuisine, and new taste. But at a certain age, you cannot adapt that new cuisine and new taste.
Right.
And when they get whatever food they used to at home, there, and even better tasting and better varieties, and therefore I think, and of course, a great, excellent medical care, and that's why since last 16 years, my support is always with them, and they can always count on our Parikh Valval Media and ITV board for any good initiative or whatever we can do. We are here for service.
So Joselyn, how is AristaCare compared to other subacute rehab programs?
Well, I've had the luxury of only working for AristaCare, so I wouldn't know firsthand, but being in this company, I can say that they're very family oriented. Like Robert was saying, they make everyone feel like family, red carpet treatment. And they do the same thing with their staff too. So, you know, the staff is family as well as the residents. And you can see that on the floors with the residents and the staff, the way they treat each other, the way they talk to each other. It's very heartwarming to see. And I really feel like we're special in that way. AristaCare is special in that way.
Talk about your Better Care program. You have a Better Care program, like something I read about you on your website.
Yes. So our Better Care program is a concept that incorporates the full model of healthcare. So for example, traditionally in rehabs and nursings, you would have a physician that's in charge of a patient, that oversees the patient, their primary care physician, but it's phone-based medicine. Meaning, if you have a question in the middle of the night, the nurse calls the doctor, the doctor is at home, gets a telephone call, you're waking up in the middle of the night, he's sleeping. He doesn't have a good full picture of the situation. Now he's making decisions based on that telephone call. We want our better care model includes the concept of, we have telemedicine. So we can bring a piece of equipment into the room. You, just like in Star Trek, one of my favorite shows, you beam up Scotty, you beam up the doctor, and the doctor will be able to, literally because of the technology, be able to have a stethoscope, otoscope, and hear them even better than they were. And actually it's interesting because this idea came up years ago. I was chatting with a physician that does work in India, and he was telling us how they set up, because they have certain rural areas that they cannot have physicians, they set up these makeshift, these little places where physicians can see remotely. And I said, if they could do that in a village in India, why can't I do it by us in America? So, and we did. So we were the first company in the state to bring this in. That's one piece of the better care model. We have nurse practitioners in the building so that they're getting better health care. So there are many clinical components that we add. We have a cardiac program. So we have a cardiologist that comes in to oversee, just to make sure our programs are going well. So better care is the phrase and term that incorporates all these things that we do. We couldn't find a better word to say, we do it better.
I think that's a wonderful word. So this is kind of a serious question I have. Like, we have read stories on patient abuses by caretaking staff. So to prevent that, what protocols do you take?
You have great questions, and it's a very important question. I'll tell you what we do. We believe in total transparency, okay? So we take several steps to make sure that the patient and their family can get directly to top administration. Meaning we don't want to be in some big fortified office that to break through you need like special codes.
Not at all.
So here's what we have. We have a full-time position that we call Director of Quality Experience, and I was the first one who was the Director of Quality Experience. That's what I did, because that's my vision. And what that quality experience person does, some buildings will have something they call the concierge. Concierge is usually a pretty girl, handsome guy that goes around, gives coffee, and has no influence.
It's just a fancy word.
Correct. Yeah. It's like a paper tiger. It doesn't do nothing. It's fake. What our quality experience people answer directly to me. In other words, they don't. If they're walking around the building, they greet every single patient. And Joselyn was so kind to help me write up again all their responsibilities. But they're meeting every patient, greeting them, letting them know they can call them. So they're constantly meeting them. Number two, we have a feedback line. We give everyone a number that if you have an issue, that number goes to top administration. So it's not like you have to speak to the CNA, to speak to the nurse, to speak to this one.
Great.
Right.
You go on that call, that goes a feedback line to all of us. And then we have more. We have a program, a computerized program to
It captures grievances.
correct. What happens, let's say you call me and you say, Robert, my mother was unhappy because somebody was not nice to them, somebody was rude to them. Now, there's a million things going on in my day. Am I going to remember if that same aide was rude to somebody else tomorrow, the next week, the next day? Well, we have this computer program that all concerns and grievances are put into that program. Then we can check algorithms. So we see, hey, this is what's going on. Now, this computer program is not locked up that no one can access it. We give out a link that if families want to give a grievance, they can put the grievance straight through that program. So, we have that access. And we also feel that one of the most important things, which is many times overlooked, empowering your staff, because yes, you can have a bad apple in every building, in every profession, and you never know where that bad apple is. But the majority of people who work in healthcare, the majority of people who work for us are such wonderful,
Yes.
caring, loving people that want administration to listen and to hear them, and then you'll know things. So what we have done, and I used to try to do it all myself, but thank God things get busy. But we try to do rounds, and we're going to actually improving that process now more, so that we do rounds on the floor with the CNAs, the nurses, and say, guys, anything that we can do. And they hold the secret to all our information, because they'll know if their colleague is a rotten apple. And if they know that administration wants to know, they'll tell us, you know, this isn't, I come in and care is not done.
Right.
So, you know, you hear these horror stories, and no one can ever control that you don't have a person that is, like I said, a rotten apple. But we try to make that there's no red tape, that you can reach us and talk to us, and we try to take things very seriously. That's our short answer.
Very sweet.
Thank you.
Okay, so how did COVID impact your center?
Well, COVID impacted everyone's lives, especially the nursing home.
There were like horror stories, you know, the complete nursing homes, they were getting wiped out in so many cities. What about you guys?
So we were fortunate enough to have the top leadership that helped guide us through COVID. I personally was working in a building at the time. It was tough on everyone. It was tough on the residents, the families, the staff. It was especially hard for our residents who couldn't see their families. That closed door, you can no longer come in and see your loved one, because we have to make sure they remain safe and they don't get sick, because back then, you know, you got COVID, you got really sick. Now we're fortunate to have these vaccines that help us. But you know, we had that closed door policy, so it was especially very difficult for our residents to not see their loved ones and the families. Now with the staff, it was also difficult because, like we've said multiple times, the staff feel like these people are their family members. So when they saw some of these people get very sick, and some of them unfortunately pass away, you know, it really hit them so hard. And so we had to rally behind our team to, you know, help them rally behind our residents, and provide that support from the top to really make sure that everyone felt like they were supported, and you know, that translated to the residents. The residents weren't able to come out to activities because, again, you know, we wanted to keep them safe and separate. So we brought activities to them in their room as much as possible. We started using FaceTime and Zoom and so on and so forth to connect them with those family members. We were going in constantly to see these residents, whether they had COVID, whether they didn't have COVID. We PP'd it up and made sure that they had FaceTime with people, and that they didn't feel so isolated. So of course there was that isolation because there was that forced isolation, but we tried to mitigate that as much as possible.
But things are getting back to normal now.
Yes, they've been getting back to normal for a very long time, I think. You know, we had that recent COVID spike, but fortunately, many of our residents didn't get so sick.
And Mukundji, how do you kind of encourage people, you know, like coming out of this black hole, you know, the Indian festivities? What kind of, you know, message or things that you do there, you know, so that they feel more confident and encouraged?
In the COVID, what happened before COVID, we have a temple in a premises. So around 8-9 o'clock, all the residents come to the temple. It's called dining room. And they mingle and they talk together, and they start doing activity and religious things and everything. But because of the COVID, we cannot bring each and everyone in the dining room. That's why they are so afraid. Every time, most of the time, the family member come every single day sometime. Out of like, I have 112 residents, maybe out of 112, at least maybe 60, 70 people coming every day to visit their loved ones. And right away, everything is closed. No residents, family member coming. They are not going to the dining room. They think what's going on? Why? Also, we have lots of. First of all, we don't know what to do in starting. So so many nurses and so many staff, we have working with a very low staff. So 2 or 3 people, and then they think about what happened, why the people not coming, why are not family member coming, why we are not going in a dining room, and they are really, some people are so afraid. So, but we don't have a choice. So we try to go on each and every one room, and we're doing little prayer, and we talk to them what is the reality is. But it was very tough time. But
Do
all
they
the staff
accept the reality? They were aware of what is happening around them in the world?
most of the people we have from in our Indian community, 65 to almost 102-year-old people. Sometimes they don't know who they are, where they are, and they don't know. But they at least they think that my son going to become today, my daughter going to be. But all of a sudden everything was complete stop, and they are very afraid, and they don't know what's going on. So sometimes people cannot eat, sometimes cannot even, and so it was very tough time, but we try to do whatever we can, and I hope tough time is gone and it is not come back. Thank God.
Yes, amen to that. And tell me, what are the fun activities you guys have there? You talked about the religious festivals and events, but if they want to, like, say, go out, do shopping, maybe see a movie, do you have things like that? Or maybe go to Atlantic City?
Most of people is bed bound, wheelchair bound, and they are not really walking good too. So
the 65-year-old one, that category?
Not much. We have 10-15%, but still they need help to someone to go with outside with someone need. So everything we do in a dining room. They are in America, so they play bingo too.
Great.
Yeah, they do bingo. Also, they celebrate all Indian and American festival. Also, we have a calendar in all from 9 o'clock to 7 o'clock in the morning. We get up, they get up 8 o'clock, and they dress up and come to the dining room. We do the prayer and everything. Then we have a lunch in a dining room. They eat together Indian food, and if they are not able to who they are not able to eat themselves, we feed them. Around 1 o'clock we put back to bed because they are older people, and they get up again 4 o'clock, and they come in a dining room. And we have a religious program, like we do the Bhagavad Gita and some storybook and all these things. And 5 o'clock we do the Aarti over there. People were taking part of in Aarti and pujas. And then 6 o'clock we gave them dinner. And after dinner we play something, and almost 7 o'clock we put them back to bed. So whole day we we do the movie too. Okay. Because we have big screen TV over there.
What kind of movies you play?
Most of they like a religious movie.
Again, religious.
Most of the older people,
Yeah.
Sometimes yes, the older men and all this, they like Raj Kapoor movie and everything.
Oh.
We have a TV, each and every room we have a TV.
Oh, nice.
And we have an all Indian channel. So when they go to the room, they watch soap opera, like Indian soap opera and everything.
You make sure to put ITV Gold for them.
We have everything. We have everything there. So they enjoy the life, they enjoy the life. And we have an Indian doctor, Indian nurse, Indian food, Indian religious channel, Indian channel. We have a newspaper coming from
News India Time.
News India Time, and they enjoy the News India Time and everything. In certain occasion, like a Navratri, our community people come to a nursing home, and they do the Garba and Aarti.
Oh, that's so nice.
Yeah, they do. In Ankut program, Diwali program, Dr. Sudhir Parikh was there too, and we have 200-300 people. We give them Ankut Prasad. Wow. And we play them Garba and everything. They enjoy the program. They enjoy. Everybody loves this Indian program.
Great. Before we close, Dr. Parikh, do you have something to say?
Well, I would like to really admire Robert, Greenberger, Joselyn, and Mukund Thaker for their great initiative, great work. It's not really, it's a non-profit work, it's a not business, it's a real service to the community which needs this. And therefore, they can always count on my media group as well as me personally to promote their great initiative. Because always I believe that when you give something back to the community, that's called legacy, and that's only way people will remember you.
True.
And you will feel very satisfied. It's a double pleasure because person you are helping will be happy, and you will be happy by seeing them happy, and that's what they are doing it. So they are really a kind of messenger from the God, really, and doing good work. And
Great.
Keep it up. And
Thank
congratulations.
Thank you.
So I wish you guys all the best and success in nurturing patients back to health with a personal touch, warmth, a big smile, and of course the scientific expertise. Thanks for talking to us.
Thank you. Thank you so much.